Hi, it's Dr. Cabaret in Camarillo, California. I'm an interventional pain specialist and anesthesiologist and an expert on low back pain. Today I want to talk about low back pain in the elderly. This is a very specific type of low back pain that occurs in the elderly, and it's called neurogenic claudication. That's really a fancy way of saying low back pain that gets worse when you're standing and walking and gets better when you sit down or lean forward on a shopping cart. And this is due to something called lumbar spinal stenosis, which is a fancy way of saying that the lumbar canal where the spinal cord runs has gotten too narrow, and so it's squeezing on the spinal cord. And as you can see, when we stand up, the spinal cord flexes back in order to compensate for our standing up. When we sit down, the spinal cord flexes forward. As you can see here, when we flex forward, we create more space in that canal, and when we stand up, we create more crunching or squishing down of that canal. I'm talking about the central canal here where the spinal cord runs, this blue thing in this model. And so if we can find a way to prevent that spinal cord from squashing when we stand up, we could prevent this problem completely. Let me show you what I'm talking about. We now have a little spacer procedure called the Superion Vertiflex. You can see that when that spacer's in, that space no longer squishes. Without it, it squishes, and with it, it doesn't. I can place one of these with a minimally invasive procedure. Really, we go through a tube about that big. That's one of the instruments that I use, but that's really the final stage. And you can see that that's a very small tube, a little bit bigger than a McDonald's straw. The incision that we make is less than 2 centimeters long. Oftentimes, don't even need to place a stitch afterward. This is a procedure that can be done on an outpatient basis at the surgery center under IV sedation. Don't need general anesthesia. There are very little requirement for post-op pain medication, if any, and people usually feel better the same day. This is a procedure that's completely covered under Medicare insurance, so not a penny out of pocket for it. And this is something that we can now offer. Up until about a year ago, we were sort of stuck with lumbar spinal stenosis and neurogenic claudication. People who had these symptoms often didn't respond well to medications, and even the procedures like epidural injections had some limited benefit, which usually waned over time. And so it was really kind of a depressing situation for these older folks with low back pain. Oftentimes, all we could do was recommend that they go have open surgery. And a lot of these patients don't want open surgery, or really shouldn't have open surgery due to other health issues that they have. So now, in the last year or so, this procedure has come along, and we can really offer hope to these patients who previously were unable to stand, oftentimes unable to stand for more than a minute without experiencing this severe pain in their back and in their legs, along with weakness and fatigue that got worse when they stood or walked, and got better when they sat down or leaned forward on a shopping cart. And so I just want everybody to know that this procedure is available. I'm one of the few trained in the United States to do this procedure. It's called the Superion Vertiflex procedure. If you or someone you know is of Medicare age and has this type of low back pain, please give me a call, see if I can help. My number is 805-914-0637. I'd love to sit down with you and find out more about your pain and see if I have a solution for you, which may include the Superion Vertiflex procedure. Thank you.